here's where we left off. We basically had talked about FSH and LH working together to regulate ovulation and the thickening of the endometrium. And that graph alone, with the maturity of the egg, the inner lining of the uterus changes, body temperature changes, and hormone levels, pretty much took the hour. Like that was the class, okay? And so that's kind of the foundation. If you did get a chance to watch a crash course video, it's very, very, very similar. It just has cool like moving diagrams that I did not have. So things you should already know about but are noteworthy is the hypothalamus is a very important piece of the brain that is talking to your pituitary gland. So the hypothalamus releases GnRH, which is gonadotropin releasing hormone, just like in males. And GnRH tells the pituitary gland, go for FSH and LH. And the pituitary gland releases FSH and LH, and then those guys go on to the ovaries, and we start this whole follicle maturation and estrogen production and endometrium thickening and all the stuff we talked about yesterday. So we're not going to talk a whole lot about those. If you remember from the guys, we had mentioned that, you know, girls produce small amounts of testosterone, but of course lack testes. So where is that coming from? It was coming from the adrenal glands on top of the kidneys. So this is a secondary location for the production of estrogen and progesterone. There are still small amounts of estrogen produced in the adrenal cortex. And so that's the same thing for the guys, right? Guys lacking ovaries, well, how are they getting these small amounts of estrogens? It would be the adrenal glands above the kidneys, of course. I had mentioned before, kind of in passing, that the kiddo, when it produces placenta, also releases hormones that says, hold on, don't ovulate, don't have a period, there's a kid on board here. And so that's a secondary source for those hormones that are basically stopping the hypothalamus from releasing hormones to turn on the pituitary gland to start another cycle. You will not start another cycle, obviously, when you're pregnant, right? For the 38 weeks, 40 weeks, whatever that your average pregnancy is going to run you. There's no period, no menses, no menstrual cycle. That endometrium is maintained until the kiddo is out into the world. And it's normally not picked up until a few months after birth, which can be delayed even further if the mom is breastfeeding, because there's a whole additional cascade of hormones that goes on with nursing a child that basically regulate the ovarian cycle to produce eggs, and says, you know, don't produce another egg right now because there's a kid suckling, right? Nursing. If mom's not breastfeeding the kid, then generally speaking, she'll jump back into a regular cycle pretty quickly, because if you're feeding the kiddo formula, your body's thinking, oh, I'm not feeding a kid. So it must have, like, I don't know, not made it roll on to the next kid. And you know, ovulation starts clicking right away. So kind of a weird secondary hormone regulation thing, but I just had to mention it. Let's see. Maturation of egg cells, already talked about it. Change during monthly reproductive cycles, talked about that already. Secondary sex characteristics, talked about that already. So we're fine. Okay. Pardon my congestion. Hypothalamus secretes GnRH. That, at this point, should be kind of old information to you, honestly. GnRH goes to the pituitary gland. We've already talked about that a couple of times. Pituitary releases LH and FSH. LH and FSH are headed to the ovary. And that's pretty much it. It's just, I don't know, we've talked about it a few times. We saw it with guys, we saw it with gals, and there's a lot of overlap there. And so that's pretty much it. We've already talked about the bottom point too, LH and FSH. What are they there for? Make a primary follicle turn into an egg and ovulate, and make estrogen and progesterone levels higher in the bloodstream so that they're able to thicken the lining of the uterus. I just heard a car horn honk.
That was my toaster.
Oh,
Maybe.
we're good. At first I thought, I think my children just started a car. And then I hear them screaming, Grandma Wendy. So grandma's here. They did not start a car. Okay. Sorry, I just had some worst case scenarios rolling through my head. I don't think they're ready to drive at 8, 6, and 3. Oh, check that. My girl is 7 now. 8, 7, and 3. Okay. LH and FSH make eggs. No duh. We know that already. Sorry, I'm being silly. Production of estrogen and progesterone. We also know that already. Let's see. If you want to see it in a chart, there's the same exact information in a chart. We we've talked about all of these. That's not necessarily true. We haven't talked about mammary glands. That's kind of a cool one. Let's see. Yeah, we've talked about all these except for mammary glands. So progesterone, let's see. Okay, progesterone is going to spike during like contractions during birth. Progesterone goes up. There's even an artificial hormone that causes contractions that you can get like injected in you. What is that called? Pitocin, I think. I don't know. What I think it's Pitocin. But anyways, basically these hormone levels are super super high during birth and up to birth, and the mammary glands are going to become basically filled with milk, and so there's preparations to produce milk and be able to lactate before the kiddo is even born. Once the kiddo is born, progesterone is very very high, and lactation should be, you know, pretty easily started up. Not necessarily that it's easy, but it should be ready to go physiologically. After the kid suckles, it's a positive feedback cycle, and progesterone stays high, which also keeps the ovulation off for a bit, because it's kind of like if you're feeding one kid, maybe you shouldn't get pregnant with another like immediately. Like it's okay to have a break for a couple of months between birth and pregnancy. And so that's kind of what's going on there with progesterone. So that's a cool secondary effect we hadn't really talked about. Let's see, female sex hormones. Androgens, sure, we can talk about that. There's a few, you know, smaller concentration of testosterone and other male hormones from females, just like there's smaller concentrations of female hormones in males. So let's see, what are we talking about here? We're talking about hair growth in pubic and axillary regions. Axillary is your armpit, secreted by the adrenal cortices. So again, we're talking about the little glands on top of the kidneys, and the lower levels of androgens produce narrower shoulders and broader hips. That's pretty much all old stuff. So just kind of so you know that. Here's the same graph we had with the guys. We just switched an ovary for a testis, and nope. Whoops. We switched a testis for an ovary, and we switched testosterone for estrogen. Okay, other than that, it's the same. Hypothalamus releases GnRH. GnRH goes to the anterior pituitary gland. Pituitary gland releases FSH and LH. FSH and LH get down to the gonad. In this case, it's an ovary. It produces more estrogen. There's more estrogen in the bloodstream. If you get too much estrogen, shut the hypothalamus down. You get less GnRH. You shut the whole cycle down. I feel like we've talked about this particular sequence of hormones like, I don't know, 7 times. So for your test, you should know hypothalamus, GnRH, FSH, LH, anterior pituitary, and gonads, because holy moly, we've talked about those guys a lot. Let's see. Breast develop, sure. Got to feed a kid somehow, right? Increased vascularization of the skin, interesting. Accessory reproductive organs enlarge, sure. Increased fat deposits, breast, thighs, buttocks, sure. Secondary sex characteristics of a female, right? Not terribly tricky. All right, mammary glands, something we haven't talked about a whole lot. These guys up here are mammary glands. They fill with milk prior to lactation. They're all connected with ducts, so they are exocrine, not endocrine. All the ducts lead to the areola, which is the darkened area, and the nipple, which is what the kid will actually pull into the upper part of their mouth to cause a letdown reflex, which is basically what lets milk out of the body. More suckling, more milk production. It is kind of a weird thing, like why are we learning about an areola? But like it's funny, like every little thing has a design, and this one I think is particularly interesting because the reason an areola is pigmented, I don't know if you were knew this or not, or how they even tested this, but I guess when kids are born, little brand new 1-day-old babies, they only have clear vision for about 8 inches. At least that's what I've always been told. It's a very, very short, clear visual field, and their vision is almost entirely black and white. They don't develop cone cells that are functioning for a bit yet. And so children can't see very far when they're brand new born. And so having a nipple surrounded by a darker area of skin is kind of like a bullseye for the kid who can't see very far to be able to get milk, because humans are mammals, and without milk in the days before, you know, formula, we didn't do so well. So you got to have milk to keep the kid alive. Let's see. They secrete milk. No duh. They're over top of pectoralis major muscle. No duh. They're over top of ribs. No duh. If you didn't know how kids were fed, now you do. All right. Let's see. Birth control. This is always a funny slide. Um, you know, I'm not here to push a particular view, but here's the many, 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 many options and how they anatomically do what they're supposed to do. I'm not saying you should or you shouldn't or whatever. After marriage, you make this decision with the spouse. But there's basically you can prevent fertilization, you can prevent implantation, you can like hit it at different steps essentially. And so I'll let you decide morally and ethically where you sit on any or all of these. But basically, birth control is the idea that you might want to have some input into the number or timing of children you have so that you don't just have 20 children over 20 years and have so many children in the school bus you drive around. So options for birth control are varied and changing all the time. First one is interruptus. You don't have to write these down, by the way. I'm not going to put this on the test. Just, this is just do with this what you will. Coitus interruptus is you have to stop sexual reproduction prior to ejaculation, then no sperm are out there and you're not going to have any kiddos. Option 2, the very risky rhythm method. Rhythm method is basically using a calendar. And you say if ovulation occurs on 14 days and you track the day 1 of the period starting as day 0, essentially, if you don't want to have children, you don't have sexual reproduction on or near day 14. Give it a 3 or 4 day buffer on either side of day 14. No sex during that time, no kids. If you want to start a family, then day 14 is your day. And then, you'll have kiddos in no time. Mechanical barriers just pretty much have to stop semen from getting to the cervix. If you can stop that in any way, then obviously they're not going to make it to the fallopian tubes and there's not going to be any babies made. Condom goes on the guys and keep sperm from getting into the girl. Diaphragm goes in the girl and is like the same thing but for a girl and keeps sperm from getting to the cervical orifice. Cervical cap goes around a cervix and keeps sperm from getting to the cervix. Can't get fallopian tube and no baby's gonna be made that way. Spermicidal foams or jellies, just a terrible word to say, really. Terrible word to read, terrible word to say. Is a chemical that kills sperm cells. I'm thinking, surely there must be a better way than the word spermicidal jelly. Just the word. That's a weird word. Anyways, chemical barriers, again, chemicals that you put inside to kill sperm. Seems odd to me, but, whatever. It's an option, I guess. And then surgical methods. Might want to be sure before you make that decision because that's kind of, semi-permanent unless you're Michael from The Office. Snip, snap, snip, snap, snip. But, generally speaking, this is not a like, do we want to have kids this month or not? Like, well, holy moly, if you're cutting tubes, you're kind of done. But basically, a vasectomy is the vas deferens was the tube that went from the testes up and around the long term to become like the ejaculatory duct and that kind of stuff. So doctor cuts open the scrotum, cuts the vas deferens on each testis, ties them shut, essentially sews you back up, and now no sperm cells can leave into the ejaculatory duct. Ideally, assuming the surgery is like effective and stuff, then no more kiddos forever, ever, ever. So that's like not really a family planning, like, do we want to have kids this year or not? That's like you're done now. And then tubal ligation is the same thing, but for women. Now, this one's a little more invasive because your gonads for the girls are inside your body. So it's a surgery to go inside and take the fallopian tube between the ovary and the uterus, take the fallopian tube, cut the fallopian tube, fold it over, sew it shut, clamp it shut, that kind of stuff. Now, hormones are still produced, eggs are still ovulated, they never make it down the fallopian tube. What do you want from me, Lucy? You wanted in the room and now you're barking. I can't make you happy. I'm teaching a class right now. Okay, sorry. We got dog issues. All right. And so the eggs can never get to the uterus. So then you're going to be having no kiddos. So those are kind of like the permanent, like, are we done having kids for the rest of forever kind of decisions, assuming they're effective. Tori.
So does that like cause backup in the fallopian tube, or like how is that okay?
Yeah, egg cells are super small and they'll be digested by the body. Yep.
Okay.
I mean, just like sperm cells, right? I mean, if a girl gets tubal ligation, she's still producing eggs. Eggs are still ovulated. Egg is breaking down in the tube. If a guy's producing sperm, sperm are still ejaculated up to the tube, hit a dead end, stop there, dissolved by the body. Yep.
Okay.
Because you're still producing both of those eggs. Yeah. Unless you were to take some sort of, I don't know, let's see. Last year. Are we going to get off topic? How are we doing on time? I'm nervous. 17. I think we can do this. Yeah, sure. Last year. I'm not saying yes or no on whether it's a good idea, but like, holy moly. They made a birth control pill for guys that was supposed to stop. Gallon Ziploc bag next to the microwave. Pick any one. They'll have like this much stuff in it. Okay, go, buddy. Just a friendship bread. My 8-year-old coming in while I'm discussing sperm. It's totally normal. Okay, at any rate, the question was, what was the question? Oh, they made a birth control pill for guys last year. Oh my goodness, I couldn't believe it. Still in experimental stages. Some were getting it as a shot, some were taking it as a pill, and it was basically shutting down sperm production. And I was like, dang, that's like at least interesting. I can't believe it. But I guess they're having a lot of muscle pains as like a secondary side effect, which really, I don't know, makes you wonder what that has to do with testosterone or what. But anyways, so yeah, there's more than one way to, do that, I guess. But let's move on. And we've got other methods we got to talk about before we're out of time. Let's see. Other options. Preventing ovulation. So guys, you're out. Girls, this is on your side of things. There are more methods of this than I'm familiar with, if I'm being completely honest. So I apologize for that. Oral contraceptives are popular, used to be popular. Basically, it's a pill every single day at the same time. Okay. Estrogen, progesterone, or estrogen, progesterone mix. Basically, the lady has to get in a habit of, I'm up every day at 7. Every day at 7, I take this pill. So she keeps steady estrogen, progesterone levels in her blood all the time. She'll probably still have 2, 3, 4 periods a year, maybe. And during those cycles, she could totally get pregnant. But the odds of getting pregnant when you're only having 3 cycles a year are pretty like low, right? So oral contraceptives are kind of like your quick, easy, cheap, not very complicated solution to, kind of this whole family planning situation. But there is a downside that I think is interesting. If she forgets a pill or she forgets 2 days in a row, her estrogen and progesterone levels are going to tank and it can cause her to ovulate. Like she'll pick up that cycle because she missed those 2 pills. So that's kind of, I think that's neat, but that's one method. Okay. The second method, which I think is fascinating as well, is injectable contraception. So basically if she knows I'm going to forget to take my pill every single day at 7 a.m. There's no way I'm that dedicated. They go into a doctor. I think, I don't have any experience with this. I'm sorry. I think last I knew it was like once a month. Give them a shot. And it's just like getting a little flu shot. She's pumped up on estrogen and progesterone. See you next month. No ovulation, right? So it's the pill without taking a pill. Works pretty good. Contraceptive implants came out, I don't know, maybe a decade ago, maybe more. Basically, it's an itty bitty, teeny tiny capsule. It's about the size of a matchstick. They'll make a little tiny incision somewhere people don't really see, and they will shove this capsule under the gal's skin, let it heal up. And that's good for, I'd hate to throw out a number because I'm probably wrong at this point, because last I knew about them was years and years and years ago. It's good for a long time. Okay, you don't have to come in every month for a shot. I don't know if it's a year. I don't know if it's 2 years, but it's this low kind of leaking estrogen progesterone mix for years, which is pretty cool. So that's a contraceptive implant, or take it as what it is. I think it's a fascinating thing. I don't know if I would necessarily choose it, but it's cool. All right, what else we got? Preventing implantation. Oh, okay. This one kind of it gets at my heart a little bit. So here's the thing. Not telling you what to do or what not to do. Okay, talk to your parents about it. Talk to your pastor about it. Wait till marriage, that kind of stuff. Preventing implantation puts like a little burr in my saddle, to be completely honest, because like preventing ovulation, an egg never made it out of the gate. Cool. So like I'm fine with that. I have personally, which you shouldn't care about my personal opinion, but like personally, that causes me no heartburn. There was no egg ovulated. Preventing implantation totally causes me heartburn and puts a burr under my saddle, if you will, because basically what that means is that an egg was ovulated, a sperm made it to the egg, they fused and made a zygote. The zygote divided on its way down the fallopian tube. And by the time that kiddo's out to the uterus, you might be talking about 16, 32, 64, there could be hundreds of cells, right, that have all divided. This kid is like developing. And these contraceptive methods make the endometrium of the uterus inhospitable to implanting of the embryo, fetus, baby, blastula, pick a term. The kiddo cannot dock in the endometrium of the uterus. And so the kiddo is discharged out of the body. A normal monthly cycle follows, and there's no pregnancy. Most people wouldn't know it or see it or perhaps be bothered by it. But yeah, boy. And again, this is my opinion, but essentially you have a human, a small one, but a human that you flush down the toilet potentially, a few times a year. And holy moly, that gives me heartburn. I tell you what, that just, I can't quite do that one. So I would, not that my opinion matters to your decisions later in life, but I think in my personal opinion, that's not cool. So that's where I kind of sit on that. And you make your own decisions by all means, but just be aware when it says prevents implantation, that means a viable human being is being flushed down the toilet. So do what you will with that information, but that one makes me kind of sad talking about it. So we're going to move on and not talk about it anymore. I'm getting sad. Anyways, yeah. And just read up on it, because every birth control method has like a cute little like color print pamphlet that your OB will give you. And it doesn't really tell you that much. And then online, you can find a black and white PDF that's like 45 pages long about this particular drug or this particular contraceptive method. And those are fascinating because they will tell you primary methods of contraceptive methods, secondary methods, and tertiary methods. And a lot of them, like even your every single day pills or whatever, will have like a tertiary method of preventing implantation. And it's like 0.01% of pregnancies or 0.1% of pregnancies or something like that, right? And so just, I'm not trying to give you like too much personal information. I'm not trying to be that guy. But, when my family, we were looking at that and, we were reading through these super boring PDFs, trying to make smart decisions. And, we were looking at these, it's like the secondary or third method. And they were all on there. All of them had this third method, prevents implantation. And we kind of sat down and we're like, man, that's like a 1 in 100 shot or 1 in 1,000 shot that it's going to prevent implantation, 99.9% of the time preventing ovulation. And then 1 time out of 100, you might flush a kid down a toilet and not ever know it. Are you comfortable with those odds? And that's up to you. You choose what you want, but we just, weren't comfortable with the odds. I couldn't live with that. I can't hardly do that. So I couldn't do it. Anyways, so now you know. So I got 3 kids. Anyways, so let's see. Now implantation. Okay, there are drugs that are injectable straight into the muscle. Doesn't allow the kid to implant. Makes me sad. Contraceptive implants that are hormonal that do the same thing. IUDs have changed. So, 20 years ago, it's like all IUDs are preventing implantation. And, people are like, oh, this is not cool. IUDs is an intrauterine device. Okay. Intra, within, uterine, within the uterus. There's a lot of different types of them. You'd have to talk to your OB and figure it out. But they used to primarily prevent implantation. I'm not sure how those have changed or improved in the last decade. I'm not a doctor, so I'm not going to kind of speak outside of my scope with that. But they're a thing. Whether they're good or bad or otherwise, I'll let you decide when it's your turn to figure that stuff out. And then a cervical ring is basically a little ring that's fitted around the cervix so it stays put and releases hormones that way. It's exactly like the other hormone-based releases. Instead of a shot, it's just a little device that goes up in there. Abstinence is the only 100% effective method. If you're not having sex, you won't be having children, except for 99.9999% if we're technically being honest, because that counts as 1 out of, hundreds of millions of billions. So there's abstinence. Now you know that. Surgical method of birth control. Here's the you're done forever kind of thing. Cut, sew them shut, tie them shut. I don't know what they do, but there's something down there. And next thing you know, there's no sperm getting out of that guy. Here's the same thing. Generally speaking, it's a lot more invasive on the girls than it is on the guys. Guys' gonads are descended outside of the body, right? This is like a 1 day, 1 hour thing. Girls, this is like a big surgery. So just be aware, okay? Cut the tube, tie the tube, eggs are released, eggs can't get to the uterus, then there are no babies coming out of there. At least there shouldn't be. I don't know how that would work. Sexually transmitted diseases are now called STIs, or sexually transmitted infections. Some things you should know about them is basically if they're bacterial, they can be cured with an antibiotic. If they are viral, they cannot be cured, and you will have them for life. Herpes is viral. Genital warts is viral. HIV/AIDS are viral, and they're going to be for a lifetime. A lot of them can cause infertility. AIDS will eventually cause death. You might not show symptoms during herpes. Just think like a cold sore, and you basically have the idea for herpes. It's cold sores like flare up and go away, but you can still pass them on. And there's a variety of complications. Quick note for all you young Christians, I think this should be worth saying. If people just waited until marriage to have sex, and one man was with one woman and they just stayed together, and I know this is like an ivory tower thing, but just you should note this. If everybody did that in a hypothetical situation, there would be no STDs. Like zero. There would be none. Because it's a closed loop of sexual transmission. You only get sexual transmission when there's promiscuity. If one guy is with one gal and they both wait till marriage, there's a 0% chance of ever getting a sexually transmitted infection in your entire life. So it's kind of like, that's a neat design. Seems like a simple solution, but such is life. Let's see. There's all sorts of terrible symptoms of STDs. I'm not going to bore you with like the terrifying pictures that would haunt you, but basically, burning during urination, pain in the abdomen, fever, discharges that smell bad or of terrible colors. I don't know. I don't know, but I'm imagining it's probably pretty not great. Pain, itchiness, sounds not great. Sores, rashes, itchy, runny eyes. I don't know. I think if you get syphilis, you end up losing your mind and dying if you don't get it cured. You like go insane at the end. It's kind of a fascinating thing. Clinical application, we've already talked about BPH. It's the weird commercial with like the dad and his 2 kids. 1 in 3 men over 50, blah, blah, blah. And that's the, prostate gets big, pinches down on that urethra. Granddad's got to urinate every 10 minutes, only gets a few drops out, and he's just uncomfortable all the time. I guess there's a whole bunch of risk factors for him. Having a fatty diet, well, we're in America. Probably put a check on that one. Certain environmental factors. Wow, thanks. That's super helpful. I don't know what that means, but there you have it. You can surgically remove a prostate. It's kind of a big job. It's a pretty big surgery, but you can do that. My father-in-law just had prostate cancer, and they took it out, and he did fine. But it was a healing period after that. That's for sure. You can insert a balloon into the urethra and kind of blow it up, sort of like we saw them do with arteries earlier, with a stent, which we also saw surgeons do with arteries earlier. Let's see if there's a tumor there. You can freeze it off. There's all sorts of things you can do. But with that, holy moly, how do we do? Yeah, it's the last slide. It's 9:30.